Dr. Mark Morin, retired physician and patient at the Laguna Hills Coumadin Clinic.
Coumadin is a very effective drug and tricky to control.
If you're on Coumadin, you need to be evaluated by a physician every 3 to 4 weeks. We draw blood in the office and have your results in 5 minutes.
I am seen by a real doctor who evaluates, charts, and controls my doses so I can stay healthy, active, and playing tennis. Be smart and in control at the Laguna Hills Coumadin Clinic.
We all want to be in good health, and one way we can be in good health, of course, is to eat and exercise and do all the right things, see our doctors on a regular basis. But something else we can do that not only contributes to health, but specifically health of others, is donate blood. Joining us today, Dr. Thomas Hiroshi, who is an expert in that field of blood donations and blood products, and of course operating the Coumadin Clinic here in the community as well. You're also very active with the blood donation program here in Laguna Woods, right out of the hospital. A fairly new facility, I think, has been going on over there.
It's a brand new facility. Good morning.
Good morning. Good morning. Face it, not everybody's comfortable with needles and giving blood, but for those that are, it's a very important thing that people can do. Can we talk a little bit about that, some of the parameters and who's appropriate and who isn't to donate blood? I guess being in good health, and I guess that's a determination that you make, but also that we as a person makes, but they also make that on site.
Yes. The blood donor program at the hospital, so important. The nation is experiencing such a shortage in being able to help patients that need blood during surgery, for medical procedures, for just general health.
Yeah.
And it's a very simple way to determine whether you're able to donate blood. You just have to be healthy, be of normal weight, greater than 110 pounds, be 17 years or older. And there is a little bit of discomfort with the needle end, but the needles that we use are so good that if the hint is not to look at the process, and on occasion you don't actually feel it that much.
And the reality is that normally once the needle's been inserted, and they're pretty good at what they do,
Yes.
within less than 30 seconds you don't feel it anymore.
That's right.
If it's done right.
That's right.
And usually they do it right. So there. It's interesting, we hear a lot about ways that companies and organizations help people to encourage people to do good things. And last year, we know Disneyland had a special promotion on your birthday, you got it for free.
Yes.
This year, they're doing it with doing good things for the community. And one of the options that people have to get a free day at Disneyland is to donate blood. So if that motivates you, like it does our Ken Goldenberg, not just out of the goodness of your heart, but you get a free day at the Magic Kingdom. So that's a possibility as well. They do check a few things health-wise. They check they look at you, they can tell if you're 110 pounds. They usually do a little finger stick to check
to see the
oxygen
blood
level?
The blood count.
Blood count.
Yes.
Okay. And they check your blood pressure. If someone's got real high blood pressure, they probably will be excused from donating blood as well.
And they want to make sure that don't have a fever.
Right.
And that, that your blood pressure is in the right range.
There's a few other things that are interesting. You mentioned 17, the weight. Tattoos within the last year. I mean, some people have gotten them when they were in the service, or some people have gotten them. It's become fashionable again for a lot of people to get tattoos.
Yes.
If they have a tattoo, as long as it's a year old, they can still donate blood.
That's right. And it's one of the requirements that's slowly changing, because in the old days, the needles that they used for the dyes were reused or re-sterilized, and that created a problem with the increased risk of transmitting hepatitis.
Right.
But nowadays, most tattoo parlors use, or I should say all the licensed tattoo parlors use, one-use dyes and one-use needles.
Kind of like the hospitals do with injections or medical treatments. They have every hospital, every doctor's office now has one of those little boxes, and they put the syringes and the needles in those.
Yes.
So that's very important. And of course, obviously, the Red Cross and the blood donation centers, like the one you operate over there, use a fresh needle each time and it gets thrown away.
It's all disposable.
Right.
But I wanted to return to your point. There is a website at Disneyland that Saddleback is listed. And what a tremendous community service. 1 million tickets for people that will serve the community, and this is one way that can be accomplished.
That's a wonderful program indeed. The other thing is maybe, we have a lot of travelers out there. Certain places in the world, if you've been during certain times or certain places, may exempt you from donating.
That's correct. And everyone should realize that the blood that we give to other patients is safer than it's ever been. And it's for several reasons. One is the testing, but also what you're alluding to is to look for parts of the world that have a higher concentration of malaria or of mad cow disease or of other viruses like the HIV viruses. So when a potential donor comes in, there are certain maps that are issued by the government that we check to see if there is a higher rate of those things, and a small portion of the world has exclusions for certain parts, certain time periods.
Mm-hmm. We're going to have you back in a couple weeks and talk more about this process and how it actually is done medically and all that and the importance of it. But real briefly, how often can a person donate blood if they really are healthy and feel up to this?
Every 60 days.
Really, that
Yes.
often? Yeah, okay. And of course the blood is used, some might be used right here at Saddleback, some might be used at other local hospitals or for other emergencies.
We have such a need. All the units of blood that we're collecting in the donor center at Saddleback is used at the hospital.
So anybody here in this community that makes a donation probably is going to help one of their neighbors.
And the message is bring in your friends, family, and relatives. So important.
Yeah.
Because there's such a shortage.
Yeah. I know a lot of teenagers are getting behind this now. A lot of the high schools, even in colleges, are having blood donation days on campus, encouraging the students to do that. And it gives them a little break from class, and they get a couple of cookies and
Yes.
some juice and are on their way. And they recover pretty quickly. Your body replaces that blood fairly quickly, I know.
Very, very quickly. Within 3 days, your fluid status is
Yeah.
all normal.
I guess the day of and maybe the day after, you might want to not go out there and do too much weightlifting
Yes.
or ride your bike too hard. But other than that,
Normal activity,
Normal
but
activity.
not strenuous activity.
right, very
yes.
good. We'll see you back here in, I think, 2 weeks.
Yes.
Doctor, good to have you with us. Thank you for joining
Thank
us
you.
today. Dr. Thomas Hiroshi, the expert on blood, and again, the Coumadin Clinic as well. He is operating right here in our local community and doing a great job of monitoring people's various blood products as well. We'll be coming back with more right after this time out.
I had 2 open heart surgeries when I was 29 years old. I was told that I was going to have to take Coumadin for the rest of my life. For 15 years, my proton went unregulated.
If you're on Coumadin, you need to be evaluated by a physician every 3 to 4 weeks.
At the Coumadin clinic, I get my blood drawn right away, I get the results right away, and I'm seen by a real doctor. Since I've been regulated, I've been able to do my gardening, my stained glass, and I ride horses.
Laguna Hills Coumadin Clinic is located on the Village Bus Route.